D3 is on the posterior midline, below the spinous process of L4. D4 is on the posterior midline, below the spinous process of L2. REN2 is on the lower abdomen on the midline at the superior border of the symphysis pubis. So going down the lower abdomen using the side of your hand until you find the pubic bone. Looking at where the midline is on the body and marking your point on. REN3 is on the lower abdomen on the midline. It's one cm superior to the symphysis pubis. REN4 is in the lower abdomen on the midline, 2 cm superior to the symphysis pubis. Stomach 29 is on the lower abdomen, 1 cm superior to the pubic bone, 2 cm lateral to the midline. Large intestine 4, you're going to find the length of the second metacarpal bone. So running your finger down, finding the base, making sure that you're not actually on the carpal bones themselves, finding the midpoint of that shaft of bone, coming between the first and second metacarpals, nearer to the second than the first in the muscle.
Spleen 6 is located 3 cm superior to the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. Be sure not to place this point actually on the bone. Spleen 10 is located 2 cm superior to the superior border of the patella in a tender depression on the height of the muscle vastus medialis. We know the patella is 2 cm long, so we can use this to calculate how high up the leg this point should be. A common mistake is to mark this point too far anterior or medial. A good location tip is to have the person press their leg down into the bed, which will bring vastus medialis into relief, and you should be able to palpate the depression in the height of it that forms spleen 10. Bladder 60 is located directly posterior to the prominence of the lateral malleolus. It lies in the deepest dip between the posterior border of the malleolus and the anterior border of the tendocalcaneus. Kidney 5 is located 1 cm directly inferior to kidney 3. It is anterior and superior to the calcaneal tuberosity, which is this bone that forms the heel. Locate kidney 3, palpate down one sun until you find a nice cleft in the cartilage that is superior to the bone.